Thank you, Ruth, and thank you, Sharon. Good morning, good afternoon, and good evening, as the case may be. The topic for today's discussion is how do we explore real-world data and real-world evidence, especially in the light of data privacy and how it can help shape the health policy by encouraging participation of patients and the patient groups as well. Uh, in the sessions earlier, we have seen a bit about real-world data. If you look at the FDA definition, real world data is data which is relating to patient health status and the delivery of healthcare. And of course, real world evidence is the evidence that comes out of the usage of certain medical products and this is based on the analysis of the real world data as well. The typical sources of real world data come from the clinical operations. They might be health records, they might be lab records, they come from administrative sources, insurance claims, for example, and some of the sources are from the financial world as well, how patients spend on the medicine purchases as well as on their cards as well. Uh, in comparison to clinical trials, some of the challenges that we face with real world data are related to the quality of data which is available, the accuracy of the same, whether there is some bias which is involved over there, and general acceptability by the regulators as well. Since we are talking about data privacy as well, privacy does have a plethora of meanings. In simple terms, it might mean the right to be left alone. It might mean the right to have control over one's personal data as well. Some of the key principles that apply when it comes to privacy are that patients should be aware of the use of their data. How is it being used? How is it being shared with others? What is the purpose for which this data is collected? And those purposes should be limited as well. Um, we also talk about minimizing the collection of data when it comes to real world studies as well. Coming to the APMA region or the Asia Pacific, Middle East, Africa region, what we have seen is that there is a wide variety of laws which are applicable. I'm going to share a quick overview of some of these legislations across the Asia Pacific, Middle East, and Africa region. As you can see, the diversity is pretty high. Some countries have very basic versions of laws in place, what is highlighted in the very light green color marked as basic. Some of them have slightly more comprehensive laws. So they have developed the laws, they are getting mature, but not quite there yet. And then you can see some countries which are marked in dark green, where we do see that the laws have been there for some time, they are pretty comprehensive, and the implementation is fairly good as well. Right? So as you can see, there is a fair amount of diversity in the APMA region. With this as the context, I would like to invite two practitioners, and we'll talk about how we safeguard your personal data in the real world data collection process.